For everybody that doesn't know me, I am taking over Aurelis' spot for now. I am Chandler Berry. I am the data coordinator for Turning Point. I just want to welcome everybody to this presentation and thank you for joining. Today's educational event on nutritional challenges for chemo and radiation patients. Before I turn it over to Lisa, we want to remind everyone that Turning Point is a 501c3 nonprofit and that we are able to host these educational events free of charge because of support from the community and individual donors. We all know that October is Breast Cancer Awareness Month, and because of that, we want to highlight our social responsibility partners. Lisa, if you can click the slides so we can see those.
Okay. There you go.
These are our businesses and individuals that are hosting fundraisers for Turning Point this month and beyond, and we are beyond grateful for their support. Please follow us on social media at MyTurningPointBCR, where you can learn specifically what they are doing and how you can support them in supporting us. All right, Lisa, I'm going to turn it over to you.
Okay, good morning, everybody. My name is Lisa. I'm the dietitian here at Turning Point, and today we're going to hone in more on, for those of you who are currently going through cancer treatment, chemo, radiation. And so I wanted to address and help those patients there that are going through some of the struggles of both of these cancer treatments. So some of these common side effects, this is a whole list of what can happen if you're currently in the hub of your treatment with your chemotherapy. These are some of the things that you may experience, and anywhere fatigue, we hair loss, easy bruising and bleeding, infections. The highlighted ones are the ones that we are going to address here during this telehealth, is so that we can manage some of these awful side effects. So there's no side effect. All the side effects are listed. Not every person goes through every single side effect. I want you to remember that. So I have a lot of patients that get a little bit worried. They're like, well, I'm not as sick as so-and-so is, or I'm more sick than so-and-so is. Is something wrong? And just to be rest assured that every body responds different to the treatment, everyone. And so you may have some of these symptoms, you may have none of these symptoms, but you may have all. So we're just going to address them. We're going to work on how we can manage them via our food and make things a little bit more manageable during this time. So first, we're going to address nausea. Nausea, and let me backstep. A lot of the ones that I'm covering are a lot of the side effects that a lot of my breast cancer patients under treatment do experience. Not that they're only exclusive to breast cancer, but there are different drugs for different types of cancer. So you can have somebody that has colon cancer that is not experiencing anything what you're experiencing, and that's because that is a different targeted therapy. It's a different drugs. So not everybody experiences the same thing. So on our breast cancer end, nausea seems to be can be problematic. It can be problematic for a lot of breast cancer or for lots of cancer treatment. So right now I'm just talking about chemotherapy. Generally with radiation, we don't experience a lot of nausea unless we're doing radiation and chemo concurrently. Radiation, unless it is more around the stomach area, if it affects the esophagus, those kind of things, a little bit of the nausea, if it's around that gut, can cause some nausea. Generally, my breast cancer patients, when they are receiving radiation, do not experience the nausea unless they're doing concurrent chemotherapy as well. So what can we do with nausea? All right, nausea is the one. Nobody in this world really, hopefully should be nauseous from the treatment that they have. That is one of the huge side effects. First thing that's not even on here is I want you, you have medication. Your doctor gives you medication for nausea, and I want you to use that medication proactively. It is not beneficial to wait to use medication until you have full-blown nausea. I usually recommend if somebody has a little queasy stomach, go ahead and take the medication, because we want to be in front of that ball rather than have that it's like almost like a snowball rolling down the hill, that we become nauseous, we can't catch up, and need more medication. And you can spend days in this state of trying to catch up and trying to tame the nausea. So take your medication as prescribed. talk to your physician, talk to the nurses there. Sometimes they will have you pre-treat, before treatment, do some anti-nausea. After treatment, depending on what drugs that you're taking, you might have you do it for 2 or 3 days post-treatment. I would definitely recommend that. The biggest thing from anti-nausea, the biggest side effect is constipation, and we're going to hit that in a little bit. But with nausea, when it's most important, and this is the most challenging time, is because we don't feel like eating. Our appetite is poor. We don't feel well. And so it's most important that we keep some food on our stomach. An empty stomach causes nausea to be worse. So that is the key thing. It doesn't have to be a huge full meal, but we have to have something on our stomach at all times. We should never really ever skip a meal or never skip a snack. It's best for everybody to eat small, frequent meals. During this time, and I've said it in prior seminars or webinars, is that your nutritional needs increase, they incline during cancer treatment. So with that being said, this is the most difficult and most challenging time to get all those nutrients in because we don't feel good. So it's easier to get your needs met if we do a smaller, more frequent meal. So, and a meal, what is a meal? You know, a meal can be a piece of dry toast with a smear of peanut butter. A meal can be a piece of dry toast with some cheese on it. A meal can be a rice cake with some peanut butter. But it doesn't have to be a full meal. It just needs to be something to keep on our stomach. One, that's going to help with the nausea. Two, that's going to help get your nutritional needs met. Another way that we can combat some of the nausea is on the chemotherapy days, we need to eat something small before your treatment. I've had a lot of patients say that they skip breakfast or they skip their lunch for fear of getting sick while they're at their treatment. And in all actuality, that emptiness and the void in your stomach can make the nausea worse, or can actually make you get sick during your treatment, or add to that sickness. So it's better if we have something little. It can be something bland. It really low fat foods, really nothing that's high greasy, something that sits real nice on your stomach. You can actually, I keep reverting back to like the toast. It can be a sandwich. It can be, you know, some low fat yogurt with some berries. It does not have to be anything hot and heavy. All right. One of the key things when we're nauseous, when we have the nausea, is we don't want you to eat, this is not the time for comfort food, for the fact that comfort food will play a role later. Like when our appetite is low, we can pull in comfort food, but when we are nauseated, we avoid comfort foods for the simple fact that we will have a negative connotation with that food. So if we eat the food, we're nauseous, we eat the food, we feel worse, then we're going to eliminate that food. It's called food aversion. If you ever get sick when you're little, or sick now on a food that you've eaten, you have that aversion, like, I don't want to eat that. I don't want to look at it. And we need those comfort foods at different parts of your treatment to make you feel better, to bring in more energy, to bring in more calories and more protein. So during this time, it's going to be very, very simple, no comfort foods at this point, okay? We want you to sip on liquids throughout the day is the best way to manage. Another way to manage, they should be cool. Clear liquids are better tolerated than a warm liquid. Warm liquid tends to, or a hot liquid tends to exacerbate that nausea. It can, the hotter liquids. So something cool like a ginger ale. Ginger actually has anti-nausea properties to it. So ginger is one that I tell people, get some ginger ale that has real ginger in it, not ginger flavoring. You can buy ginger gum. You can buy ginger tea. You can actually buy, I've had the ginger root. I've had people steep tea out of that. I've actually had recommended that you cut a little wedge, take off the skin, and kind of, you can put it in between your cheek and gum, and that ginger will help with the nausea. Also will help with dry mouth as well. So ginger ale is good. Apple juice is good if we're not having a lot of diarrhea at this time, and we're going to talk about that in a little bit. Broth, any broth. And I usually, at this point, I recommend doing a bone broth if you have that on hand, or if you can make it, or have friends that can make it. Bone broth is going to give you some other, I mean, it's going to give you sodium, and that's what we need at this time. We shouldn't be afraid of sodium during treatment unless we're off the charts with hypertension, but we'll talk about that. But broth is a good way, bone broth especially, because it does give some protein. And as I said a little bit ago, your protein, you need more protein, you need more calories the minute you start any type of cancer treatment. In all actuality, you need more calories and protein when that cancer starts developing, because that cancer just starts to take over. Those cells start to utilize things. And then with some people, they lose weight. You know, they feel lethargic, they're losing muscle mass, and that is due to the tumor growth. Teas are okay. Again, teas, as long as they're not overly hot. So it would be a cooler tea. It could be a tea at room temperature. But those type of things are better tolerated sipped throughout the day. I find at this time with nausea, sometimes people will, you know, like they usually drink like their favorite cup, like coffee. They drink coffee. They love coffee. This time they can't even say the word coffee without feeling a little nauseated. So your body will determine how you're going to react to this. So if it's coffee that you're like, I just can't, I love coffee. At this time, you might not love it. And that is a normal side effect as well. Popsicles, you can suck on hard candy. Some of the clinics I used to work at the front desk, they would have a big bucket of Jolly Ranchers or a big little lemon head. Those are good. Those are the tartness that tends to help. The mints, you can suck on mints, but any type of hard candy is going to help with the nausea. That's also going to help with dry mouth. That's also going to help if you're having trouble with, well, some of the, we don't want to do mint, and we don't want to do really the lemon drops if we're having any type of mouth sore, but Jolly Ranchers can help soothe. We can suck on, there are little things called like Prego Pops are anti-nausea, like suckers and types of things like that. You can get Tootsie Rolls. Those are suckers. Those can actually help with decrease the nausea. So the bland foods, you know, toast, we keep reverting back to that, but a lot of my patients tell me that their nausea, how they feel is they equate it to morning sickness. So I usually ask them, like, how did you manage your morning sickness? And, you know, whether it be a dry toast, whether it be, you know, goldfish crackers, sometimes pretzels are fantastic, and pretzels are great just because they give you that sodium, and we need that extra because we tend to get a little dehydrated through this time. So those types of things are great to have, but if you ever had morning sickness, I just recommend kind of revisiting some of those things that you might have done to help alleviate and eliminate that at that time. Foods that are colder at room temperature, and that is because we decrease smells. Okay, lingering smells. We want to avoid very odorous foods for several of these side effects. But you know, chemotherapy especially changes a lot in our body. If you've had your first treatment, you know things are changing. Chemo affects our rapid turnover cells first. So what is that? Your skin. We turn that over all the time. I can scratch myself, my skin starts to repair. Hair obviously is one that's one that it turns over constantly. All these rapid turnover cells. So all of our GI, so all in our mouth, all in our esophagus, our gut, all of that, and those cells are affected. So things may taste different. Common side effect. Things may smell different. So smells that used to spike an appetite or spike interest, like the coffee, I would imagine, can now actually lead to more nausea. They can actually be not right on our stomach, the smell can actually make you sick. I've had patients in the past that would walk into the clinic and say they could smell chemotherapy. I mean, I can't smell it, but their nose and their taste are so acute at that point that they smell the chemo. I had a woman would actually come into a clinic holding a half of a lemon wedge. So that's all that she smelled. She can handle that. So strong smells can make that nausea worse. One other thing is, if we think about that, and we think about family members helping and cooking dinners and wanting to help, things that have lingering smells. So now is not the best time, especially those days after your treatment, because we do have that high and the low. We we have our treatment, and then we have this okay because we on the anti-nausea, and then we have this low. And during that low, kind of the nadir, the low, we avoid these things so that we don't spill into extreme nausea. But foods that linger. So using a crock pot generally is a great idea, but during these several days, it's not the best idea. You know, cooking a pot roast in the oven, not the best idea. So if we're not feeling great some of the time, family members may have to, you know, go to neighbors and cook their food, or cook things that have very low odor. Cooler foods, you know, that cold foods are not as odorous, and the odor does not linger as much as hot foods. So the family might be doing all cold foods, like cold pastas and stuff like that. So just keep that in mind. And you want to avoid really fatty, really spicy, overly sweet foods, because that can just make things worse. Now, with that being said, I have actually had people that said, you know, I can eat a donut and that helps my nausea. Well, that is, like I said, everybody and everybody's body responds differently. So just because these are on here does not mean these are the absolute no's. These are some things that can exacerbate the nausea. All right.
We have a question, Lisa.
Yeah. Yes.
We have a question from Edna. Are there any herbal supplement recommendations to aid with side effects?
Very good question. At this point, we don't recommend any herbals. And I know ginger is not really an herbal, but that is the one that is you know, safest at this point. The herbals have not been studied, and some herbals can actually interfere with the treatment, with the chemotherapy. So if I were you, I would always talk to your doctor about those, or talk to, if you have a dietitian at the clinic. I could absolutely research those for you. There are some that are safe, but they're not regulated by the FDA, any herbal or really any vitamin supplement. So we have to be really cautious during this time, because, you know, you're putting chemotherapy in your body, this chemo, we want it to work to its full potential. So we don't ever have to do this again. And so we get rid of this nasty disease. So I would always err on the side of caution with herbals. Okay, I hope that one answered that. We'll go to the next. Our appetite changes, okay? Very common side effects. So appetite changes for just many reasons. And if you've gone through a cycle or 2 cycles, you know, we have the highs and the lows. And, you know, we get our treatment. Generally what happens is, you know, treatment day, and even like that night, most of the time, even the next day, people are feeling like, oh, that was nothing, you know, like after the first treatment. And then it's like the 3rd day, the 4th day, sometimes the 5th day is when we start hitting that kind of the low. And so during that time, you know, our appetite isn't the greatest, and at all. And the nausea might have kicked in. Other things can have kicked in. So we have to remember, though we don't have that gnawing hunger pain or that screaming hunger pain, we have to remember our body needs nourishment. Our body is hungry. We can't let our body get overly hungry, because what does that cause that to do? That makes nausea even worse. So we have to fuel it. Now, when our appetite isn't there, your family, well, I'm sure they can get very frustrated, because you're like, I don't want anything. And they're like, how about this? And they're, how about that? And how about that? And you're like, no. It's best really just to tell your family, just bring me something. Just bring me something bland, something, you know, you can give them a list of things, because the more sometimes that they ask you, the worse that you're going to feel. And it's no ill intent by them, because I'm a caregiver, and we know as caregivers that when you're undergoing cancer treatment, how important it is to eat. So we'll be on you, like, please eat, and please eat. What do you want to eat? I'll make you anything to eat. So just tell them, just bring you something. And when they bring it, it needs to be very small, like they're feeding a toddler. Like, you will have portions the size of a toddler, and that is perfect and okay. A couple of reasons for that: very large, heavy meals on our stomach is not good. That can actually make the nausea worse. But it just, at that point, putting a full plate in front of somebody who is challenged with appetite is very discouraging. For the fact is, you know, it could have been a plate that you used to eat before in the size, and it's perfect. But at this time, it seems like a mountain of food overwhelmingly amount of food. And so we shut down, you know, like I can't eat it. So I can't eat all of that. So I'm going to eat zero of it. And it's not a good idea. So we need to eat that food. So smaller little bitty meals. Toddler, pretend you're a toddler, and that's what we should be taking in. If you can only do a couple of bites, that's perfect and that's fine, because another thing that goes with the appetite, the loss of appetite, is early satiety. And that early satiety comes exactly that. It means you get satisfied with a meal early. It could be after 2 bites, it could be after 3 bites. But with that early satiety, what I make sure I tell people to remember is that just because you took 3 bites at breakfast doesn't mean that's your only meal and that's your breakfast. That means that's 3 bites for that little mini meal. And then in like an hour, or maybe an hour and a half, 2 hours, do it again. And then a couple hours again, do it again. Just keep fueling, okay? We're gonna avoid drinking a lot of liquids at our meal time, just for the fact that the liquids are displacement. They fill up the void. So if we don't have a lot of room and space in our stomach for our food because it's taken with our liquid, then we're gonna eat less. So with that being said, it's immensely important to stay hydrated, you know, during this. And I'm sure some of you'll get, you know, like my nurse told me I need to drink 3 liters of water after treatment, or my nurse told me I need to drink, you know, a half a gallon or a gallon. So we want you to do that, but it's best in between those meals. And it doesn't have to be huge amounts at a time. It's best, like I said, for the nausea, just to kind of sip on those throughout the day, okay? You know, this one, eating in a more enjoyable place, you know, like your pretty dishes. I didn't put the rest of this, but like pretty dishes, it could be at a little cafe table in a pretty sunny place. Or, you know, if you want to sit and do it right in front of television, that's fine. If that's comforting and enjoyable to you, then that's where we need to do it. I always recommend, you know, we like to sit down. We enjoy watching television. I always recommend having snacks and treats disposable at your sofa, or at your love seat or your recliner. They should be there, because a lot of times our energy level is really low, and you might feel like, I could eat something, but I really don't have the energy to get up and go get it. So have a whole basket. Have somebody create a basket for you. It can be granola bars, it can be fig bars, it can be any of that stuff. Keep that on hand right by you. Peanuts are great. Trail mix is fantastic. That's high calorie, high protein. Those kind of things at arm's reach should be there. Bottles of water at arm's reach should be there. So if you're not having the energy in those 3 or 4 days to get up and go, then that's fine. That's what they should have, that all easily accessible. With that being said, we need to be as physically active as you can. I don't expect anyone to go to the gym or run marathons, but a short walk an hour before a meal can actually stimulate that appetite. It can actually make you feel hungry. And at this time, I know it's challenging. Maybe it's just a walk around the living room. Maybe it's a walk to the mailbox and back. Maybe it's walking up and down a flight of stairs once. Just moving around, it's better to get that blood pumping and circulating, because that too is going to help stimulate the appetite, but it also is going to be better. You know, laying still, I always worry about, you know, the circulation and getting the blood clots, you know, potential for blood clotting. So move around. It doesn't have to be running a marathon, but it just needs to be movement. Okay. And then here I just said that keeping the high calorie, high protein snacks on hand. I always recommend traveling with things as well. You can do granola bars. You can do liquid supplements. There's a lot of liquid supplements out there, i.e. like we're talking about Ensure, we're talking about Boost. There's a new one out that I've enjoyed, and a lot of patients tolerate it well. It's from Kate Farms. That is a order online only. But those are great. That's one that's complete vegan, if we've got a lot of vegan out there. But that one doesn't seem to be as overly sweet for the taste buds. So you can try that one. But nuts and seeds and making your own trail mix, you can't beat that. It's a fantastic way to go. So that's with our appetites. We're going to stimulate small, frequent. We're going to keep doing that. That's going to be the trend here, the theme. All right, so with a lot of these anti-nausea, like I said, unfortunately,
Lisa,
Constipation. Yes.
sorry to interrupt. What was
Yep.
the recommended bar that you said?
Recommended. I'm sorry. For.
The if you go, I think it was something about the peanut butter bar or something like that. I forget what she said
Fig
exactly.
bars, granola bars, things that are overly sweet. That all of those, at this point, during this point of our treatment.
Oh, sorry, we have clarification. The liquid
Oh,
supplement.
the liquid. All right. So the different types. Kate Farms is one that's a newer one out there. That is online only. But Kate Farms, they have different. They've got a standard, and then they have a standard 1.2, meaning 1.2 calories per cc. I usually, with my breast cancer patients, it's just regular standard, and it comes in vanilla and it comes in chocolate. They're both, I tasted them both. Vanilla is good. I know that the supplements, those are great ways to get a lot of extra calories and extra protein in. But our taste change and what happens during this time is that, since our rapid turnover cells are affected first, so our taste buds can change. So sometimes people get they're very acute to sugary things, and sometimes it's salty things. I have someone that says I drink one of these supplements and it's way too sweet, or I ate some green beans at my aunt's house and they were way over salty. So they become more sensitive to different flavors and things. So salty can be one. Sugary, a lot of the times what I have people do, if someone says, I can't eat something because it's too salty, I actually will tell them to put a little bit of sugar on it, and vice versa. So if something tastes way too sweet, then I have them put a tiny bit, not a lot, a tiny bit of salt on it. Kind of balances that, because it's our taste buds that are being affected, and so and we've got all these different taste buds. So that is one thing that a trick for just your taste changing.
We have one more question from
Sure.
Karen.
Okay.
Any tips on texture pickiness?
As far as, okay, so I'm not sure. I'm not quite sure I know that people experience that, but are tips about how do we manage that, if we can clarify, or how do we, if you can clarify, because texture is that's a tough one, because I have people that do not like and you can't get over, you can disguise a texture. And I'll use myself as an example. I do not like the texture of yogurt. I don't like the texture of just regular oatmeal. I love steel cut oats that have to have that bite. So for me, yogurt, just yogurt, any yogurt. So I eat Greek yogurt every single day. But what I do to my Greek yogurt, I add things to it that gives it a texture that I like. So I add fruit, I add chia seeds to them, and then I add a whole bunch of like walnuts, peanuts, or walnuts, almonds, that kind of stuff. So I take a texture, like if something that I know is so very good for me and I like the flavor of it, the texture gets me. So that's what I do. I doctor it up. If that was a question, I hope that answered it. But if not, if you just go ahead and clarify the question, hopefully I can elaborate
Yes,
on.
I believe that's it. She said when it's too rough or too soft, stuff like that.
Yeah, well, if a texture, so if it's a texture of like a vegetable that's too rough, or I mean if it's too rough, then obviously we would cook the vegetable a little bit longer, or fruit. If the texture of a fruit, then what we do would we would either cut it in smaller pieces so the texture wouldn't be overwhelming, like say an apple. I'm thinking of an apple, like a texture of that. Some people really don't like that texture, that crunchy. So then I just have them cut it and chop it in tiny little bitty pieces, and then it's like a 1 by 1. And then the mushy kind of yogurt kind of thing, we just add things to it. And at this time, if it's something like a yogurt, like adding nuts to anything that you're eating is phenomenal, because those are extra calories, and a little bit extra protein, and really good extra fats, and they're a huge amount of extra anti-inflammatory fats. So that's one way. And if you need further, I mean, we can go on, but I'm hoping I answered the question. Okay, so we'll go on to the next one. So with the constipation, a lot of the anti-nausea medications, unfortunately, can cause constipation. So what do we do about this? So I want you, first and foremost, I want you to keep track. Everybody has their own constitution. So I'm not going to sit here and say you must have a bowel movement, 3 times a day, or you must have one every day. That is not me to tell. That's what your body does. So prior to your treatment, that was your constitution. That's how you did things. Your system did things. So that any kind of change in your bowel movements from what you did prior to treatment can quantify as constipation. So say you had a bowel movement every 3rd day, and now you're still having a bowel movement every 3rd day, but you read literature and says, oh my gosh, you must have a bowel movement every day. I'm constipated. No, you're just fine. Your body is fine. Now, if you had a bowel movement every other day, and now this is day 4 and day 5, then that's constipation. So then we need to treat. So with constipation, all these are very important, but we need to increase the fiber intake, okay? And this is the tricky part, is because we're not feeling right. Things might not taste good. Like, I don't want to eat fruit. I don't want to eat whole grains. So this is where it's tricky. We really want everyone to get about 25 to 38 grams of fiber every day. It's challenging when we're not undergoing chemotherapy. So it can be challenging. So we try to, the best that we can, increase these high fiber foods. The biggest thing, your whole grain breads, we know cereals, we know raw fruits and vegetables, seeds. You can do prunes, you can do raisins, nuts. But those are ways that we can increase fiber in the diet. But the trick with increasing fiber is making sure we get enough fluid. If you increase fiber intake and you don't increase fluid intake, you're just going to back things up even more. So before I want people to start bumping up fiber, I always tell them start increasing their fluid intake. All right. If you tell me I cannot increase any more fluid, like if you're feeling the nausea from, some people just can't drink that much, you don't jump on and increase your fiber, because you're going to cause things a little bit worse. At that point, then we get medication involved. I talk to the doctor about it. But ways that we can manage it, increase those high fiber foods if we can. Drink more liquids. Warm liquids in the morning time can help produce the bowel movement. So like your coffee, or I tell people warm up some apple juice, warm up a little apple juice. You can do a warm water with a lemon slice on there if you have no mouth sores, but that will help stimulate the bowel to move. Not just in the morning time is a perfect time to do it, just because that's your first beverage, your first introduction to the gut is a warm liquid, and that tends to help produce a bowel movement. But you can drink that stuff all day long, that's fine. Again, light exercise, this is the theme with a lot of these. And I'm not talking about running a marathon, I'm just talking about moving, okay? Getting the blood circulating, getting blood flow to the gut, moving, when we move around, that's gravity, that's gonna help pull things through. So moving around is important. And then, with constipation, we feel distended, we feel miserable. And so at that point, we don't want to add misery, and we don't want to eat a lot of really gassy foods, because that's just going to it's not going to make the constipation worse. It's just going to make you feel worse, because that gas is going to be extra pressure on your tummy. So apples can produce gas, avocados, we know beans and peas and cabbage and broccoli, milk, like fizzy drinks. So it could be, your sodas, it could be, LaCroix, it could be anything fizzy. So if those things tend to help with nausea, like ginger ale, then what we do is we open that ginger ale, we let it get a little flat, and then we can consume it, but we don't consume the straight up, stir it with a fizz. We're going to avoid the chewing gum and using straws, because that you get sucking air, I shouldn't say gas, that can produce the gas. We're going to cut back on foods that can contribute to the constipation, and Milk, the dairy group tends to do that. It can do that. So we really want to watch out for those if we're consuming a lot of those. Just an FYI, those nutritional drinks that we talked about before are not milk-based. They're more soy-based. The Kate Farms is a pea protein. So, and it's not ridiculously high in protein. It does, I think, have about 5 grams of protein, which is perfect, but it is not a milk. It's not a dairy product, so it should not contribute to the constipation. And the biggest takeaway with this, do not use any kind of enemas or suppositories at all. You need to ask your doctor before you start taking anything as far as like the laxative, the stool softener. Those are safe, but you are undergoing cancer treatment, and your team needs to be aware of what else is going in your body at this time. So absolutely no enemas, no suppositories, no, none, absolutely none. Okay, so we'll go on if there's no questions with that. Okay, so we go from the flip side from constipation to diarrhea. Chemotherapy itself causes diarrhea because of those. Remember, I told you about the cells and the lining of the intestines, and it generally will cause diarrhea. But all the medication that we do in conjunction with our chemo can cause the constipation. So if we go through, and in the beginning, sometimes it's that tottering back and forth, like diarrhea, constipation. So with diarrhea, a lot of people will think that we need to increase our fiber at that time. And we don't, because fiber, why we increase fiber when we have constipation, fiber actually, there's 2 types of fiber. You have soluble and insoluble. And your soluble fiber absorbs the fluid. It makes that stool bulky and nice and fluffy, not as hard like with constipation. And then there's the insoluble fiber that is your bulk and your roughage. And that is like, it tickles the intestine. It tickles them to move. It gets the guts to move. So when we have diarrhea, we don't want a lot of insoluble fiber. We don't want a lot of that. We don't want a lot of bulk. We don't want a lot of raw vegetables, raw fruits at that time, because we don't want that stimulation. We can have a lot of more of the soluble fiber, which is like in your oatmeal, and then some of your cooked vegetables. You can cook a vegetable and break down some of the insoluble fiber, but you can actually get some of it can break down some of the soluble fiber, but it also will be beneficial with insoluble. Okay, so we're gonna avoid those milk and milk products, because sometimes, for some, not all, some that can cause diarrhea to be worse. Not all. Okay, so if you're like, hey, I have diarrhea, but I can do my milk, then perfect. You do milk, don't cut it out, because milk gives you calories, but milk gives you some protein, a good bit actually. So I wouldn't cut that out. I usually have people, if they can do milk, or if they're leery of milk, I say, why don't we try a lactose-free milk? So a good one I love is Fairlife milk. And the reason I like that for my cancer patients is that it has 13 grams of protein in an 8-ounce cup, and we can add that to so many different things. So if you're wanting to do milk and you're a little leery, the lactose sometimes will cause the bloating, the gas, it can cause diarrhea. So if we do a lactose-free, sometimes that solves the problem. The pastries and candies and really rich desserts and really sugary things, we're watching out for that, because it's just a shift in fluid in our system. When something that's very concentrated carbohydrate is the fluid shift, and then more fluid is brought into the gut to help manage those, and sometimes that will cause the diarrhea to be worse. Okay. Fried and greasy foods. I think this is our theme, that, sometimes we crave them during treatment. After you're feeling better, after like a week or 2, it's almost about, well, for some, it's about halfway through, you're starting to feel yourself come back, like halfway, and then you're getting up, you're going, feeling better, and then it's time for treatment again. So in this little lull up here, if we're feeling great, anything is fair game, anything. But it's just, we're talking about in this little deep crevice when we're not feeling the best. Okay. We're always going to avoid, this is alcohol or tobacco use, it's just going to make that worse. Avoiding those really super duper high fiber foods at this time. We're not gonna sit and like crunch and munch on raw fruits and vegetables, like I had said. we want to be very, 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 very careful of sugar-free foods. So sugar-free gums and candies, there are like nutrition bars out there, like high protein nutrition bars, high protein, low carb, that have a lot of sugar alcohols in them. So you've got to be really careful with those. The sugar alcohol can exacerbate diarrhea to the point it's like it just makes it really, really hard to manage. So sometimes it's as little as some gum, some sorbitol in gum. So just read a label on everything. The label will say it'll have total carbohydrates. It'll say how many grams of sugar, how many grams of added sugar, and it'll show you how many sugar alcohols are in there. For my cancer patients, 0 is really the best number of sugar alcohols. They tend to upset people's stomach who aren't going through treatment. So just be mindful of those. If you're exacerbated and keep thinking like, why do I keep having diarrhea? Well, here I'm sitting and chewing 10 sticks of extra sugar-free gum every day, and that there's sugar alcohol in that. So be mindful that way. We do want you during with diarrhea, we want you to get sodium in. So because you're depleted, we want you to get sodium and potassium in. So sodium, a good way is salty foods. You can do those pretzels, you can do broths, you can do soups. And at this time, believe it or not, I don't stick my nose up to things like a Campbell's soup because of the sodium in it. I know that it's heavily processed, but like I said, at this point, what do we need to do? We need to get our sodium in. And if you can tolerate a Campbell's chicken noodle soup or whichever one that you like, I say go for it, because you will get enough sodium, obviously, in those, because we generally have people run from them for the sodium. You can do sports drinks, the crackers, like goldfish. You can do pretzels, you can goldfish pretzels. All those are perfect and fine to do. And then on the potassium end of everything, and I didn't write that, I apologize. But potassium, we know that bananas provide us with great potassium. If we can do bananas, that's fantastic. But our melons, honeydew, cantaloupe, those are great and fine. You can do, well, if you're going to do vegetables, we're going to avoid the high fiber, but the cantaloupe, just let that stuff get very ripe so you're not crunching. We don't want to crunch too much because the more firm, it's the tougher that fiber. So the sweeter or the longer that it's gotten to after being ripe, then it will that won't be as hard of a fiber to digest. It won't be tickling the tummy. So get those in, and then try, if after you have a diarrhea episode, is try to get at least a cup of liquid in after every bowel movement. And they should be caffeine free. And by all means, if you could do like a sports drink or bouillon at that point, or you might be able to drink some bone broth, that's going to help replace some of those electrolytes that we lose with the diarrhea. Now, if we are experiencing extreme and your multiple episodes, we need to really, at that point, you need to call the doctor. Do not think that you're a pain or you're a burden. You need to call the doctor with that, because you can quickly become dehydrated, and that could quickly lead to being hospitalized. You might need to go in and get some fluids. So please communicate with your healthcare team at your office. Okay, so anemia is another one. It's just your low blood count, your low red count, and that tends to happen a lot with chemotherapy. And with this, we're going to do these. We need iron. Iron, that's what we're lacking. And then we get iron from our dark green leafy vegetables like spinach, kale, collard greens. We get some iron in, like the list says. We have eggs, we have sweet potatoes, we have prunes and raisins and strawberries. And so we see some of these foods keep looping around. So like if we're constipated but we want more iron, we're eating all these eggs, we might think like, I increase my egg consumption to help with my iron, but my constipation's worse. So then that'd be like, okay, well, eggs are going to be out as far as getting the iron because they're causing constipation to be worse. Your beans, okay, that can help on that end with the iron. Okay, beans are high in iron. You have your meat and your fish. We have two types of iron. We have a heme iron and a non-heme iron. And our heme iron is what's found in our meats, all our meats, our proteins, our animal products. Our non-heme are found more in our vegetables, our legumes, our beans. So having a variety from both will get your needs met. You can do and enriched breads, rice, cereal. There's pastas that are enriched with iron. I know as silly as this sounds, but like the infant iron fortified infant cereal or the infant snacks, they have those little like puffed rice and puffed little sweet snacks. Those are a good way to do it. You can do those if those are, and they're not overly sweet. So if we're having if our taste buds are very attuned to the sweetness or too sweet, then those can be something that we can add in. But baby food can play a role in a lot of diets or a lot of patients that I talk to. So don't eliminate that end of everything. Just because it says baby food doesn't mean that we can't eat it. Sometimes it's beneficial. We're going to consume, if we can remember, to consume a vitamin C source with every single meal. Vitamin C helps our body absorb more iron. Okay, so a vitamin C source, we know that. We know what that is. It's oranges, it's citrus. But if we're having any kind of mouth issues or soreness in our mouth, then what do we do? Applesauce, vitamin C is put in a lot of different, fortified in a lot of things. So we can do applesauce. Broccoli has vitamin C. We pull vitamin C from there's a little bit in sweet potatoes. So there, vitamin C, we can get it. We can get it. So trying to incorporate something. Peaches have a little bit of vitamin C. So trying to incorporate that with every meal, that's going to help your body absorb more iron. Okay. Then with that being said, we're going to avoid drinking coffee and tea at mealtime because the tannins in that can actually block some of the iron absorption. So those are just a couple of tricks of the trade as far as with the iron. Your doctor may prescribe you. Obviously, we're not going to start taking anything on our own. They're going to test your iron. They will give you a prescription strength if they feel that you need it. Sometimes an infusion might be needed, but these are some things with our diet that can help manage that. Okay. Now I just really wanted to touch base with this. I know we had the question a little bit, kind of almost this question earlier. This doesn't have anything to do with side effects, but kind of it does, because I do get a lot of patients, and I've said this multiple times, that they feel that they're being proactive in the fact that they're taking, a big plethora of supplements, taking this and I'm taking that, I'm taking this. I read that this helps with constipation, or this helps with nausea, and they're just taking. And at this time, it's very critical we don't do that. You are getting chemotherapy, and that chemotherapy has a job to do. And we're not sure, that supplementation is not regulated by the FDA. So we don't know if you're getting a lot of that supplement, if that's a lot or a little, or they say it's giving you a lot and you're getting a little. We don't know what the interaction will be with the chemotherapy. And at this time, the chemotherapy is boss. So we always need to talk to our doctor before we start anything at all. You can talk, a dietitian, we can sit down and talk to you and figure some things out for you. But there are resources and there are books out there that we can lead you to. But most physicians do want you to be pretty, I call it clean as far as supplementation. There are some that we have, like some that are safe, like calcium and vitamin D. Those are safe to take during this time. Your omega-3s are safe, but it's really not, taking a multivitamin. Sometimes some doctors don't want you to do that, but so it's always just be open and honest with them. Say, hey, I'm taking this, this, and this. I generally recommend someone to be clean. No supplementation. The least that I'll say, if because I know it helps us feel proactive and feel like we're doing something. A simple multivitamin is generally the way to go, and it doesn't have to be, an outrageously expensive one. It can be a generic for all that matters. But as long as it doesn't have more than 100% of any of the RDIs or RDAs that are recommended, our body doesn't need 400 or 4,000 times vitamin C. It just doesn't need it. Your body is already working hard enough, trying to beat the cancer, trying to manage the chemotherapy. And if we're going to add all these mega doses of vitamins, then your body has to manage, what am I going to do with all of these now? Like, well, give me a break. Like, let me rest. So recommend always talk to your doctor before we do that. I don't have a slide in here I've talked all about the chemotherapy, and I forgot to put my slide on radiation, so I apologize about that. But the biggest side effect with radiation, most everybody experiences, is the fatigue, the radiation fatigue. And radiation, just like chemotherapy, is cumulative. So if you haven't gone through it, or if you're going through it right now, you do it 5 days a week, and you do it, generally it depends, you can do it for 4 weeks, you can do it for 6 weeks, it depends what your radiation oncologist recommends. But the fatigue, Monday you start off great, and Friday you're like, oh, and there's really, we have a pill, like we have a pill for constipation, we have a pill for diarrhea, we have a pill for nausea, but we don't have a pill that is specifically for fatigue. We don't have that. So rest when you need to rest, but exercise, believe it or not, will help combat the fatigue. So I'm not saying to go run a marathon or go into the gym for 10 hours or even go to the gym, but a simple walk around, getting that blood pumping, that will help produce a little bit more energy and help fight the fatigue. Fatigue also comes from, it comes from the radiation and chemo, but we can exacerbate that fatigue by not eating enough, by not having enough protein in our diet, and just kind of not realizing how important food is at this time. That was the most challenging time to take it in. So those types of things, when I meet with someone, I will calculate, all right, this is how much protein you need. This is how much, many calories that you need, though that's not the whole main focus, because we'll know, you weigh yourself, we weigh you all the time, and we'll know if you don't weigh enough, you're not eating enough. But we can't really see if you're getting enough protein or not.
We have a question for you, Lisa.
Yes. Uh-huh.
What about green tea or matcha?
Oh, those are perfect and fine. Those are fine. Those are absolutely fine. As far as like with hydrating, those are okay. If you like green tea, some people are like, I hate green tea. Black tea is just fine. It has some antioxidants in it as well. So, but those are great. If the question is, are they acceptable? Absolutely, they're acceptable. As long as we're not doing gallons and gallons of those in a day. But those are fine. As long as we're not taking supplements of them. If that's a question. I hope that. Okay. All right. I believe, yeah, that was the last slide. So we do have time for questions.
Yes, we have 8 minutes for some questions. So if you have a question, please leave it in the chat box or the Q&A. So go ahead. Thank you so much, Lisa. This has been an amazing, informative presentation. Thank you, everybody, for joining.
You're welcome.
I always love your presentations.
Thank you. Except the last one, really great.
So I see that we have a question asking if there's going to be a copy of the slides. Yes, these slides are recorded and posted to our Instagram and Facebook shortly after it is finished. We have another question. What diet changes might need to happen after chemotherapy ends?
If that's the last of the treatment, great question. So when we're completely done, so I'm assuming that chemotherapy means your treatment is completed, because even with breast cancer, you can there's different courses. Some people have chemo first, some people have radiation first, some people have them concurrently, some people have surgery. So when we're completely done with all of our treatment, all chemo, all radiation, our major, like if we had bilateral mastectomy, if all of that's done, I'm not talking reconstruction yet, but after all that's done, then yes, then we recommend, then we look at like, okay, now we need to follow guidelines from the American Institute for Cancer Research about how to prevent cancer recurrence. Well, and what that is, I've had the seminar about how to just decrease your chance of any type of cancer recurrence. Those are the same type of guidelines. So I think that will probably be, that lecture will probably be, as it was recorded. So you can look at that one, we can talk one-on-one, it would be a phone consult. But if you go to the American Institute for Cancer Research, they have their guidelines as far as decreased cancer, the risk of cancer, and that's what we follow.
Kind of to go off of that question, we have one that says, will there be a class for nutrition post-chemo and radiation?
Well, We can put that on the agenda. There isn't one yet. That's a fantastic course.
Mm-hmm.
If anybody has course suggestions, I mean, we are always open to that.
Yes.
We want to talk about what you want to hear about, not what I want to talk about. So if you have any suggestions, absolutely let them know at Turning Point, or let us know.
Next question we have, could the Kate Farm supplement be a meal replacement?
Yeah, if you're doing small mini meals, the standard has about 300 calories. I believe that one, or I might be getting it confused, but they're not enough. You know, if you did it 3 times a day, it's not calorically enough unless you got the standard 1.2 formula or 1.5 formula. Those are more sustaining for life, but those are a small mini meal. Absolutely yes. A meal replacement, absolutely yes, they can be. Yeah.
Awesome.
But not that we live totally on them.
Yeah. To answer your question, Karen, yes, they will be on YouTube. I forgot that as well. So it'll be on Facebook, YouTube, Instagram. And then we have a statement saying that they would definitely want a post-treatment nutrition class.
Okay, we'll let them know. We'll add that into our agenda.
Awesome. All right. If anybody has any other questions, you can email us at staff@turningpoint.org. It's on this slide right now, so if you want to take it down. You can you can ask questions to that email, and if you want a one-on-one appointment with Lisa, you can also email that address. And just want to thank you guys for your time, and thank you, Lisa.
You're welcome. Thank you, guys.
Yeah. Turning Point is committed to supporting the recovery of breast cancer patients through survivorship education. Please feel free to express your appreciation of this complimentary program through a donation. We are thankful for our socially responsible partners for sponsoring today's event.
All right, you guys. Have a great rest of the weekend.
It'll be posted shortly. Thank you, guys.
Thank you,
Lisa.
You're welcome. Bye-bye.
Bye.
Thank you.